Hey guys, this is Dr. Chris. So one of the big things that we always talk about with our patients is, again, from a lot of different things, we want to be able to work with their hinging of the hips. And that's being able to move their hips correctly instead of always relying so much on full flexion of the lumbar spine. Again, we do need flexion of the lumbar spine. That's how we do behave. However, a lot of times as human beings and as we do any type of normal everyday work or activities, we tend to hurt ourselves. Maybe we don't have proper function of our hips. Maybe overload our lumbar spine or our lower back a lot of times. So there's a lot of named exercises that we do here in the clinic and everywhere else where we do hinging of the hips, whether it's possibly bridges, different types of deadlifts, for example. But I always want to start people first off with what we call a normal standing hip hinge. And the standing hip hinge really entails really having our hips to actually move more as we bend forward. And I always like to start people, or a lot of our patients here, or even athletes, always kind of think about sticking their chest out a little bit more and sticking their butt out more. That creates that lumbar lordosis of our spine. So from here, we think about our rod going through our pelvis and we bend forward this way versus, I'm going to exaggerate it, but versus going with our lumbar spine. So again, stick your chest out, stick your butt out, and bend forward and rotate from the hips. Think of that rotation from the hips, like a rod going through the pelvis. A couple of things that I'd like to always sometimes use as a tool for a lot of folks, or a cue, not just a visual cue, but maybe a tactile cue, is maybe getting, for example, like a staff or like a PVC pipe, or maybe a wooden staff, if anything. And from here, we can start off with our hand, one of our hands on the lower end of our lower back, on top of our pelvis, and again on the top here too. And we want to make sure that we maintain those points of contact from our head, back of our head, to the upper part of our back, and to the lower portion of our back. And from here, coming from a side view point of view, we're going to go ahead and hinge correctly. And that's where you should feel that point of contact. If you break out of that point of contact, for example, like this, then you know that's a tactile cue for you that you're doing it incorrectly. So again, using the staff or the pole, you want to have it behind your head, right between your shoulder blades, and again, right on that part of the lower part of your lower part of your lower back, on top of your pelvis. And from here, remember, sticking your butt out, stick your chest out. Think of a rod going through your pelvis, and you're going to go bend forward and up, bending down and forward and up, bending down and forward and up. Okay, do that a few times so you get used to it, because now that's a precursor to a lot of different moves. For example, if I were to do, let's say for example, we want to do regular deadlifts like RDL, Romanian deadlift, which I will go through. We always tend to use this type of motion. We are squatting, we are going to engage our core, and we're going to use our hips bringing it up. This could even lead to things like a kettlebell swing, for example. Okay? And so there's so many different types of deadlift variations we use based on the hip hinge alone. But again, as human beings, we're not going to be totally bending down and forward like that all the time in a natural reaction. But what it does, it helps us to be more aware, to help engage our core and engage our glutes, and to use our hips more versus relying too much and too solely on the flexion of our lower back. So these are some examples that we're going to go that I do go through with our patients. And in the probably next few weeks, we're going to go explore a little bit more with the hinging, where there's a bridge, Romanian deadlift, for example, street deadlift, sumo deadlift, for example, kettlebell swings. These are all great progressive moves we do for our lower back and for our core, and especially for our hips and hip hinging. That's it for today. Talk to you guys soon.